Hello everyone and welcome. My name is Irene Boache and I will be your nurse in pharmacist with Grand Kenyan University, and I'll be doing this presentation on integrating into our EHR our current CDSS tool. Alright, so the reason for this process, the hospital system, IBC hospital system, I've noticed that the management of CHF, COPD, and pneumonia will say our core measures are not being managed properly, falling short below standard, and also we've seen a lot of readmission among these patients. So for the task force, we'll need myself, the nurse informaticist. I will be helping with designing the workflow, and it's also evaluating usability. We'll need our bedside nurses that will be assessing our patient and also educating them on this project. We'll need our discharge nurses and also our providers and nurse practitioners that will also be diagnosing our patient with these conditions, right? So next we'll need our pharmacists that will also be developing and reviewing our medication education, our case managers that will be following up with our patients and also helping with discharge placement, right? We also need our IT personnel, our quality control team, and then our unit manager that will help with the nurses education and also providing support to our bedside nurses. But we'll go back to it. So this is a CDSS tool that is called the Meditech Expanse Clinical tool, right? And this tool allow us to have a dashboard that is able to provide surveillance to the care for these patients. It also fires alerts to our nurses and providers as to the care and management of this group of patients. So the tool will be able to track and provide alerts when a patient is diagnosed with these conditions, right? And nurses will receive reminders. So hospital-wise, we hope to avoid penalties deduction within as patients come back within the first 30 days after discharge. And then to our patients, we hope to provide quality care, right, to them and also empower them as they take care of themselves leaving the hospital. So crucial functionalities of this tool is to provide alerts and reminders to both the providers and nurses. It's also going to give us a surveillance platform or a dashboard that is going to track the monitoring and also send alerts to our admission and discharge nurses and also our quality control team. The plan is to go live on October the 15th. But before that, this team is going to be meeting. Our main go live is going to be November 15th, and then we'll continue with monitoring and training after our go live. We're going to be needing our main desktop computers, which also have our EHR. Because this project is going to be integrated into our EHR, that's going to be our main information technology tool that we're going to be using for this project. All right, so our task force, as you all on the line, we're going to have our next meeting hopefully within the next month, and we're going to be using our Teams link for that. So look forward for an email from me as I send you the link, and I'm also open to any questions and issues that you may have with the link. Just send me an email and I'll be able to respond to it. So at this time, I would like to ask if anybody has a question, any contribution, anything I might clarify, and just to go through what we have shortly talked about is the launching of our new EHR-Integrated Patient Education and Discharge CDSS tool. That is the Meditech Expanse tool, which will assist our clinical staff in making clinical decisions for our core measure patients. That is CHF, a COPD, and also a pneumonia patient. Thank you all for coming on the line, and thank you for your questions.